Not you.
Okay.
You do with it.
So usually I start out by tucking this guy in. Let's go back to square one. I can't. You fished him out completely. There he is.
No, it's okay.
Okay, so when you come into the room, one of the first things I ask is this pig male or female? Female. Why? What's that called?
The genital.
Genital papilla versus these papilla. So you have two papillas on your checklist, genital papilla versus sensory papilla. And I can also ask, is this pig male or female? So this is a male, and I'm going to ask what this bump is. So this is the scrotum. Okay, so let's just start with this bigger pig here. Let's start with external structures. So for the external structures, we have the genital papilla of the female. The umbilical cord is right here. This thin tongue-shaped organ that curls around the stomach, that's the spleen. Okay, for the cardiovascular system, that's the heart. Obviously, I'm not going to ask that. That's too easy. Oh, I know. However, I may ask you about the different chambers of the heart. And so, you can tell where the chambers are based on this external landmark. These are the auricles. So under this flap is your right atrium, left atrium. You can also tell your left from right ventricles by looking at this blood vessel, your anterior interventricular. So here's your right ventricle, left ventricle. So the pig's right, the pig's left. Okay, if I push this heart aside, you're going to see this big blue vessel that's going down into the heart. That's your superior vena cava. And this big blue vessel that's going up to the heart, that's the inferior vena cava. This membrane that wrapped around the heart, that was the pericardial sac. Okay. The aorta is a little tricky to see. So the best way to see it is through the descending aorta in the abdomen. This large white tube that I'm pointing at, that's the descending aorta. And if you keep following it, oh, I had it yesterday. Here it is. It has a branch. It looks like a letter Y. It's a branch that goes into the leg. And so that's where the iliacs would be. Okay. Oh, and the blood vessels in the neck, you're looking for pink, blue, blue. So here's the trachea. Here's your common carotid, internal jugular, external jugular. So internal versus external is easy because internal is more medial than the external one. For the blood vessels that are going into the shoulders, we are simply going to group them as subclavians. We tend to obliterate them, so we're just going to group them all together. Okay, what else is on your list?
Hepatic.
Oh, hepatic. Okay, this pig doesn't have a very pretty one. Then I have to, sometimes you have to sacrifice the pancreas, so I'll be careful with this one. Sometimes you see it as blue, but in this case it didn't color. There's a tube. They'll eventually lead up. It's kind of hard to see by camera. It'll eventually lead up towards the liver. And so you have to imagine that in this segment with all this connective tissue, that there's blood vessels in here. So if I ask you identify this blood vessel that's going into the liver, hepatic portal. Now, if I ask you for the blood vessels that's leading in and out of the kidneys, anything with the kidneys is renal. Now, we don't always have perfect coloration between red versus blue, so we'll just lump them together as your renal arteries and veins. Okay, for fetal circulation, it all starts at the umbilical cord. The oxygenated blood will enter into the umbilical vein, will go towards the heart. Once you're done with the blood, it will then exit into the umbilical arteries, back out towards the placenta. So one umbilical vein, two umbilical arteries. Now for the respiratory system, we have external nares, the pharynx. You just tell me it's just the general back of the throat, that just general area. This bump is the larynx, and this is the trachea and the lungs. One thing that drives me crazy is when students say pharynx versus larynx. No, pharynx, larynx. Okay, for the digestive structures, in the mouth we have a hard palate and we have a soft palate. This flap is the epiglottis. It keeps you from choking. This is the tongue and the sensory papillae. You're pretty much certain that I'm not going to ask for that tongue. It's too obvious. But The moment you see me scoop out a soft tube from behind the trachea, that tells you this is the esophagus. From the esophagus, that food will then go down to this pouch, which is the stomach. The stomach has a very thick valve at the end. This valve is the pyloric sphincter. The pyloric sphincter is then going to lead that chyme into the small intestines. So the initial curvature of the small intestines, that is the duodenum. Everything else we're going to call jejunum. They have an ileum too, just like humans do, but I didn't put it on your list because sometimes it's tricky for students to find it. But this last segment, that's the ileum. Right around where my pointer is, that's where the ileocecal sphincter would be. So we lead it to the large intestine. The first portion of the large intestine is this pouch called the cecum. It then leads the fecal matter to a spiral colon. I tend to do this hand motion where I go round and round because it's a spiral colon. But students always tell me it's a circle colon. It's like, no, spiral. Then a descending colon and out the body. Okay, now to keep all these things together, you have membranes that have a lot of blood vessels on them. So these are the mesenteries. Now the accessory organs of the digestive system, in addition to the liver, you have this greenish pouch called the gallbladder, and you are then going to have a line that exits from it. That's your cystic duct. You also have another accessory organ, this gland, this fatty white gland that lies across the abdomen. That is the pancreas. The moment I say gland, you know I'm talking about the pancreas. Okay, urinary system. So for the urinary system, here's the kidneys. Once the kidneys make the urine, these are the ureters. This elongated pouch, that is the urinary bladder. For the reproductive system, this is female. Female's a little tricky because their structures are so tiny. It's so hard to see. So see this bean? You kind of have to zoom in really close. The bean is the ovary. And then the initial squiggle that comes off it is the fallopian tube. And everything else, this large crunch structure, that's the uterus. For the male, on the other hand, so let me scoop it out. So within the scrotal sac, you would have exposed this bean. That's the testes. The cap around the testis is the epididymis. This tube that leads from the epididymis is your ductus deferens or your vas deferens. The penis runs ventrally. It's underneath the skin here. You can sort of see the tube. And this hole is the preputial orifice. And that's it. So I'll let you guys stop that.